Hi friends, I am Dr. Baby Rao of Usha Clinic and founder of the websites qmedicaldoubts.blogspot.com and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary for the medical knowledge to general people and for reference to medicos. Today I am going to discuss about the diseases of arteries of aneurysm and management. Aneurism is a sac filled with blood in direct communication with interior of the artery. It could be a true or a fusiform aneurysm, saccular aneurysm, dissecting aneurysm. It is due to the dilatation of the artery. False aneurysm is a sac lined by condensed cellular tissue which communicates with the artery through an opening in its wall and arteriovenous fistula. Congenital or acquired. Fusiform aneurysm. It is the common type in which the lumen is equally expanded, the artery wall is weakened by severe atheroma and hypertension. In syphilis, the media of arch of aorta may be weakened by endometritis of the vasovasorum. In a mycotic aneurysm, the artery wall is weak by infection either in the form of a local abscess or because of an infected embolus has come to rest at a point originates from the vegetations on the wall of the heart. In acute bacterial endocarditis, in which the pyogenic staphylococcal infection is superadded to the commensal streptococcus viridans of subacute endocarditis. Saccular aneurysm. It is due to the stretching of part of the arterial wall and commonly follows injury to the superficial arteries. Clinical features of saccular aneurysm. Intrinsic saccular aneurysm. A swelling exhibiting expansile pulsations is present in the course of the artery. The pulsation diminishes if a proximal part is applied with pressure, and the sac itself is compressible, filling again in 2 or 3 beats if proximal pressure is released. A thrill may be palpable and a bruit may be heard on auscultation. Extrinsic saccular aneurysm. Neighboring or distal structures are affected. The pressure on the veins or nerves causes distal edema or altered sensation, and the pulse is delayed or smaller in volume. Bones, joints and tubes like trachea, esophagus are sometimes affected. Differential diagnosis. Swelling under any artery, swelling over the artery, pulsating tumors, an abscess, serpentine artery, other deep-seated pain is to be differentiated from the aneurysm of artery. Natural termination, spontaneous cure or consolidation. These sometimes occur in saccular aneurysm due to gradual clotting in the sac. Extension and rupture by slow leakage or a hemorrhage. Infection may cause rupture. Treatment of saccular aneurysm. This is surgical. The scope of operation required may be indicated by arteriography, which will show the state of the artery above and below the lesion. Due to presence of mural laminated blood clot, the aneurysm dilatation is seldom visualized. Ligation and excision of saccular aneurysm. Aneurysm of the secondary arteries is treated by ligation of the proximal and distal vessels. Excision is not obligatory. Hunterian ligation. It is designed for treatment of popliteal aneurysm, but can be applied for treatment of other limb aneurysms when the simple and quick measure is needed. The ligation must be placed above the main collateral nearest the aneurysm. In this way, the blood supply to the aneurysm is not immediately cut off. The collateral circulation is given time to open up before consolidation occurs. The excluded aneurysm thrombosis and rapidly shrinks into a fibrous mass containing a porridge-like atheroma and blood clot in the center. Excision and artery grafting. It is the alternative if excision is desirable. The graft can be inserted end to end or end to side. Marta's reconstructive aneurysmography. It is excision of sac and arterial reconstruction for small saccular aneurysms of important arteries like femoral and popliteal arteries. Abdominal aorta aneurysm is often amenable to surgery. Dissecting aneurysm occurs in the aorta and its main branches due to separation of atheromatous plaque, which allows blood to insinuate between inner and outer layers of media. False aneurysm. It is traumatic in origin and extravasated blood is enclosed in a sac of condensed cellular tissue. Arteriovenous fistula. Communication between an artery and vein may be either congenital or acquired by trauma or a penetrating wound or a sharp blow. Arteriography confirms the condition. Treatment of false aneurysm. Excision recommended only for severe deformity or recurrent hemorrhage. Plastic surgeons help to ablate and reconstruct the arteries. Acquired lesions tend to be progressive and operation is indicated. The vessels are separated and if possible repaired by suturing any intervening sac being excised. That's all about the arteries of aneurysm, and in the next video I will discuss about some other disease. Thank you.